Welcome to our next to last presentation. Let's jump right in and talk about the immune system. When exposed to a pathogen or a microbe that is capable of causing disease, a person's immune system is activated. The immune system searches for pathogens and then neutralizes and destroys them. This allows healthy individuals to maintain equilibrium, to maintain homeostasis, that steady state, although we are exposed to this negative stimulus from the external environment. Our immunity from pathogens can be innate, which provides a quick, almost immediate, but a non-specific response to a pathogen, or acquired, which develops after the body is exposed to a specific pathogen and then develops antibodies. Now, on the next slide, we'll watch a short video that provides an excellent brief explanation on how the immune system works.
Every second of your life, you are under attack. Billions of bacteria, viruses and fungi are trying to make you their home. So our bodies have developed a super complex little army with guards, soldiers, intelligence, weapons factories and communicators to protect you from, well, dying. For this video, let's assume the immune system has 12 different jobs. For example, kill enemies, communicate, etc. And it has 21 different cells and 2 protein forces. These cells have up to 4 different jobs. Let's assign them. Here are the interactions. Now, let's make this understandable. First of all, let's add colors to the jobs. Now, let's illustrate the cells. The central color represents the main job of the cell, while the surrounding ones represent secondary duties. Now, the immune system looks like this. Now, the interactions. Isn't this complexity just awesome? For this video, we will only talk about these cells and ignore the rest. So what happens in the case of an infection? It's a beautiful day when suddenly a wild rusty nail appears and you cut yourself. The first barrier of the immune system is breached, your skin. Nearby bacteria seize on the opportunity and enter your wound. They start using up the body's resources and double their numbers about every 20 minutes. At first, they fly under the radar, but when a certain bacteria population is reached, they change their behavior and start to damage the body by changing the environment around them. The immune system has to stop them as fast as possible. First of all, your guard cells, known as macrophages, intervene. They are huge cells that guard every border region of the body. Most of the time, they alone can suffocate an attack because they can devour up to 100 intruders each. They swallow the intruder whole and trap it inside a membrane. Then the enemy gets broken down by enzymes and is killed. On top of that, they cause inflammation by ordering the blood vessels to release water into the battlefield, so fighting becomes easier. You notice this as a very mild swelling. When the macrophages fight for too long, they call in heavy backup by releasing messenger proteins that communicate location and urgency. Neutrophils leave their patrol routes in the blood and move to the battlefield. The neutrophils fight so furiously that they kill healthy cells in the process. On top of that, they generate barriers that trap and kill the bacteria. They are indeed so deadly that they evolved to commit suicide after 5 days to prevent them from causing too much damage. If this is not enough to stop the invasion, the brain of the immune system kicks in. The dendritic cell gets active. It reacts to the signals of the soldiers and starts collecting samples from the enemies. They rip them into pieces and present the parts on their outer layer. Now, the dendritic cell makes a crucial decision. Should they call for antivirus forces that eradicate infected body cells or an army of bacteria killers? In this case, antibacteria forces are necessary. It then travels to the closest lymph node in about a day. Here, billions of helper and killer T cells are waiting to be activated. When T cells are born, they go through a difficult and complicated training process, and only a quarter survives. The surviving cells are equipped with a specific setup. And the dendritic cell is on its way looking for a helper T cell with a setup that's just right. It's looking for a helper T cell that can bind to the parts of the intruders which the dendritic cell has presented on its membrane. When it finally finds one, a chain reaction takes place. The helper T cell is activated. It quickly duplicates thousands of times. Some become memory T cells that stay in the lymph node and will make you practically immune against this enemy. Some travel to the field of battle to help out. And the third group goes on to travel to the center of the lymph node to activate a very powerful weapons factory. Like the T cells, they're born with a specific setup. And when a B cell and a T cell with the same setup meet, hell breaks loose. The B cell duplicates rapidly and starts producing millions of little weapons. They work so hard that they would literally die from exhaustion very fast. Here, helper T cells play another important role. They stimulate the hard-working factories and tell them, "Don't die yet, we still need you. Keep going." This also ensures that the factories die if the infection is over, so the body doesn't waste energy or hurt itself. But what is produced by the B cells? You've heard of them, of course, antibodies. Little proteins that are engineered to bind to the surface of the specific intruder. There are even different kinds of antibodies that have slightly different jobs. The helper T cells tell the plasma cells which type is needed the most in this particular invasion. Millions of them flood the blood and saturate the body. Meanwhile, at the site of infection, the situation is getting dire. The intruders have multiplied in number and start hurting the body. Guard and attack cells fight hard, but also die in the process. Helper T cells support them by ordering them to be more aggressive and to stay alive longer. But without help, they can't overwhelm the bacteria. But now the second line of defense arrives. Billions of antibodies flood the battlefield and disable lots of the intruders, rendering them helpless or killing them in the process. They also stun the bacteria and make them an easy target. Their back is built to connect to killer cells, so they can connect and kill the enemy more easily. Macrophages are especially good at gnoming up the bacteria which antibodies have attached to. Now, the balance shifts. In a team effort, the infection is wiped out. At this point, millions of body cells have already died. No big deal, the losses are quickly replenished. Most immune cells are now useless, and without the constant signals, they commit suicide, so as not to waste any resources. But some stay behind, the memory cells. If this enemy is encountered ever again in the future, they will be ready for it and probably kill it before you even notice. This was a very simplified explanation of parts of the immune system at work. Can you imagine how complex this system is? Even at this level, when we ignore so many players and all the chemistry. Life is awfully complicated, but if we take the time to understand it, we always encounter endless wonders and great beauty.
If a person's immune system is weakened, their risk for infection increases. The pathogen enters the body, multiplies, and can overwhelm the immune system. In order to help this overwhelmed system, the client may need pharmacotherapy. There are several pathogens that can stimulate an immune response. Bacteria, a one-celled organism that has a cell wall and sometimes needs a host, the human body, to reproduce. Viruses are composed of nucleic acid with a protein covering that require a host to replicate. Once inside the host, they can invade healthy cells and use them as hosts or kill them. Fungus would contain yeasts and molds. Generally, they're not exceedingly harmful, except to immunocompromised clients. Finally, there's the protozoa, animal-like organisms that can enter humans through the fecal-oral route or through an insect bite. Many infections can be prevented through vaccinations. The vaccination process happens when proteins are introduced into the body. These proteins stimulate active immunity in response to the exposure. Memory B cells or T cells develop, so they will quickly mount a defense when later exposure to the pathogen occurs. 4 different types of vaccines are used. The attenuated, live vaccine would include measles, mumps, and rubella, or MMR, as well as polio vaccine. This type actually contains some of the microbes that can cause the disease, but they're in a weakened form. Mild symptoms of the disease could develop. Attenuated live vaccines should be used cautiously in immunosuppressed clients, since the attenuated virus may mutate and cause a full-blown illness. Attenuated killed vaccine contains just certain parts of the pathogenic membrane or chromosomes, since the pathogen has been destroyed by heat or chemicals. This prevents possible replication by the pathogen, but may also require boosters to stimulate further antibody formation. An example would be the pertussis vaccine. Toxoid contains bacterial toxins that have been weakened. Antibodies form that will attack when future exposure to bacterial toxins occur. Diphtheria and tetanus toxoids are examples. Recombinant involve chemical engineering that change microbes like yeast cells into proteins that can stimulate an antibody response. The hepatitis B vaccine is one such example. Vaccines generally tend to be safe. The adverse effects like body aches, headache, slight fever, or pain at the injection site are common. These adverse effects are usually relieved with acetaminophen. Some dangerous adverse effects would include anaphylaxis, uh, chronic arthritis with the rubella vaccine, and thrombocytopenia with measles vaccines. Research studies that attempted to establish a link between vaccines and autism were determined to be fraudulent. General guidelines would include obtaining an allergy history. And don't just ask about an allergy to the vaccine, ask about the type of reaction. Clients sometimes think side effects are allergic reactions when they are not. In addition, ask about all medication allergies. Neomycin, for example, is an additive to certain vaccines and itself can cause an allergic reaction. Also, give the total dose of the vaccine at the time it is due. It's especially important to prevent childhood diseases. Lastly, for this slide, please check contraindications. There are comparatively few, but we do have to assess for immunocompromised status or pregnancy if giving live vaccines. A few more guidelines follow on the next slide. Guidelines for administration would include not freezing the vaccine, which could inactivate it, keeping life support and epinephrine on hand in the event of an anaphylactic reaction, observing the client for 20 to 30 minutes to assess for symptoms of an allergic reaction after administration is carried out, and then finally, documenting. And your documentation should include the lot number of the product, date, expiration date, the manufacturer, and the site of injection. Antibiotics. Antibiotics are medications used to treat bacterial infections. They are classified according to their chemical structure and can have slightly different mechanisms of action. When a provider chooses an antibiotic, they make their selection based on several criteria: location of the infection. Some of these meds may not necessarily reach certain locations, like the lungs, which would fail treatment. Minimal toxicity. Choices made on an antibiotic that is toxic to the offending agent while having minimal toxicity for the client. We would also consider the status of the client's organ functions, specifically the client's hepatic and renal functions. Lower doses may be needed to compensate for this decline. Likelihood of organisms developing is another important criterion. Likelihood of organisms developing that are resistant to the antimicrobial agent. Pregnancy and lactation. Medications like tetracycline may damage fetal teeth. Gentamicin may be ototoxic and damage the auditory nerve. Although the mechanism of actions for antibiotics vary, they tend to follow four general actions. They can interfere with cell wall synthesis, interfere with protein synthesis needed to maintain the structural integrity of the bacteria, interfere with the DNA replication necessary for reproduction, or finally, they could act as an antimetabolite and disrupt critical metabolic reactions inside the bacterial cell. Antibiotics can also have either bactericidal or bacteriostatic effects. Often this depends upon the dose. The higher the dose, the greater the likelihood of bacteric action. And now we'll move on. Antibiotics generally have three uses. Empiric therapy. This is indicated when a client has been assessed and determined to have a serious or life-threatening infection for which treatment can't be delayed. A culture is obtained, but instead of waiting for the results, a choice of antibiotic is made based on its known effectiveness in treating the infection. Treatment begins immediately, although a change in treatment could be made after lab results have been obtained. Once results have been obtained, we would begin definitive therapy, where we use medications that specifically target the identified organism. During treatment, we continually assess the client and evaluate their response to this treatment. With therapeutic effects, we would observe a reduction in fever, a decrease in white blood cell count. In other words, evidence that the client's condition is improving. With subtherapeutic effects, these occur when there is no improvement in condition. We may need to use an alternative medication. Finally, prophylactic therapy might be initiated in order to prevent an infection. This is possible in intra-abdominal surgery, post-trauma, or with immunosuppressed therapy. Penicillin is a widely used antibiotic, effective in the treatment of many gram-positive and some gram-negative infections. Like the other classes of antibiotics listed on this page, penicillin contains a beta-lactam ring in its structure. The beta-lactam antibiotics all act the same way: they lyse or break apart bacterial cell walls. Some bacteria contain an enzyme called beta-lactamase, an enzyme that provides resistance to the beta-lactam antibiotics. Beta-lactamase inhibitors are often added to these meds to prevent breakdown of the med. A description of penicillin's action is provided for your perusal on the next slide. Penicillins enter the bacteria via the cell wall. Once inside, they bind to a penicillin binding protein, disrupts cell wall synthesis. The bacterial cell wall breaks apart and cells die. Now, antibiotics like penicillins do not kill other cells in the body, are not toxic to healthy cells, and they treat a wide range of gram-positive bacillus, some gram-negative. They tend to be well tolerated and not toxic to other cells in the body. Notable exceptions would be severe allergic reactions, which occur in a somewhat small percentage of the population. Or, in the event of superinfections, an antibiotic might kill normal flora in the bowel and allows an opportunistic infection like C. diff to develop. If a client does have an allergy to PCN, they are likely to have an allergy to the other beta-lactams. Decision to administer another subclass of beta-lactam to a client with a PCN allergy would be based on clinical judgment. If the adverse effects were not severe, like a rash, for example, then the client could be prescribed a cephalosporin. If taking the penicillin resulted in edema or hives, then an alternative choice would be made. Common adverse effects generally affect the GI tract: nausea, vomiting, diarrhea, abdominal pain. Some of these effects can be offset by taking the medication with food. And with IV penicillin, the fluids in which the medication is delivered might contain sodium chloride or potassium. It's important in that case to monitor for electrolyte imbalances. There are drug-drug interactions, and that's primarily because penicillin tends to be highly protein bound. So when administering with other medications that compete for protein binding, look to see if there's an heightened action. Right? These would include medications like NSAIDs, oral contraceptives, or warfarin. So penicillin should be taken with water, not juices. Acidic fluids might nullify the antibacterial action. Right? This would include grapefruit juice. Right? Assess for possible allergic reaction for at least 30 minutes after that first administration. It's also important to note that you need to know your penicillins. Penicillin is often combined with other medications, and these meds could have names that don't end with the suffix "cillin." Augmentin, for example, contains amoxicillin along with clavulanic acid, which helps to prevent its breakdown and allows it to circulate for longer periods of time. NVK is penicillin combined with potassium, which is added to keep the penicillin stable in the acidic environment of the stomach. Important point, know your penicillins, even though they might have different names like Zosyn or Unicin. Now, we're barely getting started today on all of the different subclasses of antibiotics. There are so many that learning them all can be overwhelming. Each has its own set of adverse effects, nursing implications, nursing teaching associated with each. Personally, when I encounter an antibiotic that is new to me, I will look it up in a drug guide. I encourage you to do the same. We're going to finish up today with some brief descriptions of the other kinds of antibiotics. First, the sulfonamides. When you see the term sulfa allergy in the practice lab, we're really referring to a sulfonamide allergy. These meds disrupt important metabolic processes in the bacterial cell by interfering with folic acid synthesis. There is a wide application for usage. Some staph, many strep infections, often used for urinary tract infections. In addition, Bactrim, sulfatrim, is a combination of a sulfonamide and a folic acid inhibitor. It's used in the prophylaxis and treatment of P. Giravici, a protozoan that causes pneumonia in clients with AIDS. Use cautiously when administering this medication with methotrexate, which can increase the chances for toxicity. Another important note here, resistant bacterial strains are common in this subclass. Now, macrolides, like erythromycin, azithromycin, are often used as alternatives to penicillin. They are most effective against gram-positive bacteria and treat upper respiratory infections like whooping cough, among others. Macrolides tend to be well tolerated, although GI upset, abdominal cramping, and diarrhea can occur. Taking with food can reduce the adverse effects, but in the case of erythromycin, it can also reduce absorption. Monitor the client for increased bleeding when taking along with Coumadin, since macrolides can decrease the metabolic action of other meds in the liver. Tetracycline has a bacteriostatic effect on gram-positive and gram-negative microbes. However, they were widely used about 50 or 60 years ago, and multiple resistant strains have developed. They do have limited use now. That's Lyme disease, Rocky Mountain fever, treatment of H. pylori would be just a few applications. This medication has a tremendous attraction to calcium and can cause discoloration of teeth. Do not take it with dairy products, since this can reduce absorption. Clients should take it on an empty stomach with a full 8-ounce glass of water. Tetracycline also tends to be incompletely absorbed in the digestive tract. As a result, it can kill normal flora, leading to development of diarrhea and possibly an opportunistic infection, C. diff. One more to go. Aminoglycosides disrupt protein synthesis and are effective against gram-negative bacteria. However, there are serious adverse effects associated with aminoglycosides like gentamicin, so their use is limited to those very severe infections. Cells in the vestibular system can be destroyed, and balance problems can develop. Cochlear cells can be destroyed, and hearing loss can happen. In addition, aminoglycosides could be nephrotoxic. Be sure to assess output, BUN, and creatinine, because the renal failure is reversible if caught quickly. If taken during pregnancy, hearing loss could occur in the baby. And that's my very quick, very brief lecture on vaccinations and antibiotics. I think I'll lie down and take a nap now. See you on the next lecture.